Welcome back to Showcase Pittsburgh on KDKA TV. I'm John Klein. Danielle Bodner is back from LIFE Pittsburgh. Welcome back to Showcase Pittsburgh.
Thank you.
Danielle, before we get started, give everybody a little rundown on exactly what is LIFE Pittsburgh, in case somebody maybe has heard of it, but they're not familiar with what you do.
Sure. LIFE Pittsburgh is living independence for the elderly, and it is exactly that. The whole goal, the whole mission is to help somebody stay at home for as long and as safe as possible. The individual does need to be 55 years and older, living in their own home, living with a family member, or living in an apartment, with the goal to stay there and receive all sorts of services that would help them.
And you guys do just about everything.
We do everything and anything.
What makes LIFE Pittsburgh different from some of the other Medicare-based health services that are out there in Pittsburgh?
Sure. LIFE Pittsburgh is a Medicare Medicaid insurance plan. The nice thing about LIFE Pittsburgh is we know everybody's name that belongs to our program. We know who they are, what they need, and their diagnoses. They are not a number to us like most insurance plans.
Is that something that means a lot? I'm assuming that when somebody's a little bit older, they want somebody to know who they are and how to help them, as opposed to, oh, you're number 674 next?
Right, exactly. The nice thing about that is it helps us coordinate all of that care that they need. We have a whole healthcare team available to us. We have a doctor, a nurse, a social worker, dietitian, physical and occupational therapy, and don't forget the transportation.
And everything starts as a team where they communicate with each other along the way. What is the staff to patient ratio?
Currently we have a little over 400 participants in our program. We have a doctor at each center. We have 4 centers in the area, and that means there are 100 participants to one doctor. The average doctor sees about 2,000 patients.
Wow.
Right. So
wow, huge difference.
Huge difference. So the access to the care and that doctor really knowing the individual is a true help to that person. He can look at and say, oh my gosh, this individual is at a risk for a stroke. We know exactly what needs to be done. The medications are talked about. There's a nurse that's involved. There's a dietitian that's making sure they're not eating what they shouldn't be eating. So everything's coordinated in one place.
And I would assume that's a little reassuring for the people coming in and their families too, that they're seeing the same doctors and nurses and they get to know them, and it's not a different face or a scary situation every time they go in, that it's something new every time.
Exactly. Again, we like to use the slogan from Cheers. Everybody knows everybody's
So when you walk in, they're like, hey, hey. How is LIFE Pittsburgh more proactive than some of the other programs?
Well, LIFE Pittsburgh is actually going to treat something before it happens. Take falls, for example. We do everything in our power to stop a fall from ever happening versus just treating that fall when it does happen.
How do you do that? In what way?
Sure. We have occupational therapists that can go out to the home and do safety evaluations. They're looking at what equipment needs to go into place. Do they need a pole to help get them out of bed, a bedside commode because they can't make it to the toilet because they have some gait disturbances. We have physical therapy who might just be strengthening them up a little bit, providing them with the correct mobility device. We have that doctor that's looking at what medications are they on. Can that cause some gait disturbances or balance disturbances? Does that need to be changed? So we're looking collectively at the whole picture.
I would assume this is something where a lot of families and a lot of people might not even know that this type of service exists, and it sounds like you can maybe save a lot of lives or treat health situations before they get worse.
We definitely can, and that's the whole goal of this program. It's that coordination of care, making sure whatever needs to happen is happening. And the best part of it is we know who they are and we're able to do that.
Well, how do you deal with, I'm assuming a lot of people who come in have multiple conditions and a lot of things wrong. How do you keep track of who has what and the multiple things that maybe one person has that the other doesn't?
You know, it's all about, again, knowing that individual. We have that doctor that's on site. We have nurses that are associated with that person. We have the physical occupational therapist. They all meet on a daily basis to talk about that individual. If they see any change on a day-to-day basis with that person, we're able to implement services as quickly as possible to make sure that all their needs are being met.
And I would think, too, for a lot of viewers who have senior parents or senior grandparents and they're struggling with trying to find the time, this might be an answer that can help save a family, literally with you doing a lot of the work.
Of course.
Is this something that costs a lot of money?
This is actually a completely free program as long as somebody qualifies. It does save the government money by having people receive these services because we're being proactive with their care. We're looking at the overall picture, what's really going on with this individual.
Before we wrap up today, Danielle, what would you like to leave people with? You always have an end message.
I do. I want people to call us now. Don't wait for a crisis to happen. If they want their healthcare provider to really know them and be able to advocate for them, contact us.
We have the number. It's easy. If you'd like some more information, all you have to do is call Danielle at 412-388-8050 or log on to lifepittsburgh.org.